Hello, everyone, and welcome to Speak Up, Learning to Advocate for Your Child, the latest in a series of webinars for individuals, families, and caregivers affected by hemophilia A and B and inhibitors. These activities are designed to enhance and expand on the education provided at the National Hemophilia Foundation's Inhibitor Education Summits. This webinar series is supported by an educational grant from Novo Nordisk. Our presenter this evening is Diane Standish, a social worker at the Hemophilia Center of Western Pennsylvania in Pittsburgh. Diane, who brings more than 20 years of experience working with families impacted by a bleeding disorder diagnosis, will discuss ways in which caregivers can more effectively advocate for their children. She will be joined this evening by two panelists, both mothers of children with hemophilia and an inhibitor. Amanda Hi-C Gallagher from Elizabethtown, Pennsylvania, and Cassandra Campos McDonald from Rio Rancho, New Mexico. Amanda works as an emergency room nurse at Lancaster General Hospital, and Cassandra is a patient advocate with Walgreens Infusion Services. Both, however, join us here tonight as full-time parent advocates, first and foremost. Our program will include a question and answer segment. To ask a question, go to the area in the far lower left of your webinar screen and type your question in the field just to the left of the Send button, which is located in the pot or area called Chat. Click the Send button when you have finished typing your question. However, please note that your question will be addressed during the question and answer session at the end of the presentation. There are no handouts for this presentation. However, a recording of this webinar will be available shortly on the National Hemophilia Foundation website at www.hemophilia.org. Before the presentation begins, we would like to start with a few polling questions to get a better understanding of the people who are participating this evening. You'll see your first polling question appearing on your screen. Have you attended an inhibitor education summit? Yes or no? We'll just pause for a few seconds for everyone to complete. Thank you, and we'll share our results for everyone. And we will now turn to our next survey question. How many people have joined you for this evening's webinar? You have a series of options from 0 to 6 or more. Again, thank you for answering that question. We'll go to our next polling question. Next polling question, how many people in your group have hemophilia and an inhibitor, either active or tolerized? Thank you for your responses. We'll share our results for a few moments. And our final polling question. How many in your group play a caregiver role? Thank you so much for your responses to our polling questions. Without further ado, I will now turn things over to Diane. Diane, welcome. The audience is yours.
Thanks, Annette. Good evening or good afternoon, everyone. I'm so pleased to have been asked to do this webinar. I'm going to start tonight with a brief presentation, just talking about advocacy in general so that we are all on the same page. I have a few tips to share, and then we'll start our panel discussion with our two moms who are on this webinar with us, and that I anticipate will be the real heart of our webinar tonight. So if we can advance to the first slide, if I can manage that. There we go. I always like to start with a definition. Excuse me. I think we all know what we mean by advocacy, but just to be sure, the literal definition is the act of pleading for, supporting, or recommending, and it comes from the Latin stem words meaning toward plus voice, so putting your voice towards something. Tonight we'll mostly be talking about advocacy in situations having to do, more personal situations having to do with your child. But there will also be some discussion of advocacy on a bigger scale, speaking about advocating for the whole group of bleeding disorders through Congress and political advocacy. That's a different type of advocacy. A couple of situations in which you may need to advocate, you may have already needed to advocate or may need to in the future, would be with your hemophilia treatment center staff or another doctor's office in the case of learning about a new treatment plan, encountering difficulties putting into practice a treatment plan, or there may be times when you disagree with something that's been recommended. I probably don't have to explain in detail what advocacy in the hospital ER or emergency room means. Most people have unfortunately encountered a situation that has required them to speak up when it comes to bleeding disorders. And in some situations there are times that you need to advocate for your child in the school setting, whether it's because you believe that your child needs some type of special program or attention, or if the school believes that your child needs something. There are some obstacles to advocating effectively. Probably the most obvious one is time constraints. Your time constraints and the doctor or teacher's time constraints as well play a big role in interfering with effective advocacy. Power differential refers to the fact that it's just unavoidable. If you are a parent and you are sensing either conflict or just a disagreement or some obstacle with a provider or a teacher, the feeling is that they have the power. They're the one who's probably ultimately going to make a decision. Now, ultimately, you are the one as a parent who decides whether to implement their recommendation, their decision, or not. But there's just an inherent power differential when you as a parent are speaking with a medical provider or a teacher. And, of course, strong emotions. When we think of our children and needing to speak up for them, it's hard to not have strong emotions, whether the emotions are anger or worry or stress or even sadness. I think probably what underlies all of them is fear, just uncertainty and fear maybe about your child's future and what is going to happen and what's going to ultimately be best for your child. So some of the pointers to having a strategy, no one's going to just walk into the school or the doctor's office and demand to speak with somebody right then and expect that that's going to be effective. Of course, you need to prepare ahead of time. And that may go without saying, but just some of the specific things. If you're at a point where you feel like talking on the phone or emailing isn't getting you anywhere, a face-to-face meeting may be necessary, and often that is really the best way to communicate your concerns. So you'd want to schedule a specific date and time to meet with the medical provider or the teacher, whatever the situation. Do your research. Of course, this means, looking up things online, talking with your child, talking with, other adults, other people, if there are other people in your family that are affected by a bleeding disorder, talking with others who are in a similar situation. Just, there's such a wealth of information now through the Internet. The challenge is, of course, sifting out what's good and what's not, what's helpful and what's, not true. But there's so much available that you will be able to find good information just by doing a simple search in most situations. I did add talking with others who are in a similar situation, you don't want to rely on gossip or hearsay because that can just build things out of control that really aren't true. So gathering facts, of course gathering other people's perspectives and opinions is important, but you need to filter out the ones that don't pertain to you and try and keep the focus on your child, of course. Practice what you're going to say. If you have an audience or another person that can listen to you, even better, and give you realistic feedback and pointers and tips about how you're coming across. Of course, make a list of questions, and you need to be selective, again, because of time constraints. You probably aren't going to get everything answered in one sit-down appointment, but at least the top 5 even. And, having priorities for the meeting, a simple way to think about priorities, just 2 questions. What is the one thing that you want to communicate to the teacher or to the doctor or the medical staff? And number 2, what is the main thing that you want to know? What do you want to find out or understand by the end of this appointment? Those are 2 easy priorities. Along with preparation, if you have any kind of documentation in the hemophilia and bleeding disorders world, we would say maybe home treatment records if your child is on home treatment to support, how often the child is being infused, what type of injuries he or she is having, the dosage, all that kind of stuff, of course. Or it may be observations. It might be a record of what you notice. Lower down on this slide, I listed, being able to describe clearly what you see. And this might be something, if you need to write it down, because it is hard to remember all these little observations, that would be very helpful. How does your child's behavior vary from his or her normal routine? Or do you see a pattern, like at certain times of day he always does this, or at certain situations she always does that? When is your child at their best? When are they at their worst? And I'm trying to be generic, speaking in a behavioral and medical way. If you have other people, other teachers, other doctors, a daycare provider, anyone else who knows your child pretty well, ask for their input, ask what they're seeing. And, of course, when you're thinking ahead about a face-to-face meeting, if there's someone who can come with you, that's a great suggestion. I'll talk a little bit more about what their role could be later, but if there is a person who can come with you, that's just a great idea. So part of getting ready for a meeting, a face-to-face meeting, is thinking about your expectations, having a little chat with yourself, and recognizing that although you may be focused on a certain solution, you may think that this is what's best. There actually may be several ways to address a problem that your child is having, or to help him or her to improve. So it's just kind of trying to get yourself to be open to the fact that there may be more than one solution. Consider that your hypothesis may actually not be correct. And I don't mean to say that, as a parent you could possibly not know something, but sometimes, the doctors and teachers have so much experience, education and experience, that they do have other theories, and there could be something else going on that you just may not be able to see. Sometimes there is no one answer, or the answer just isn't clear-cut, which is frustrating for both the parent and for the provider, whoever the provider is on the other side. We all want clear answers. I sure would love that, but we don't always get them. Understanding that your child is, of course, your priority as the parent, but each child cannot be the doctor's or the teacher's single priority. It just can't be that way because they have other students, they have other patients. And that is why you're advocating, because you are saying, hey, look, pay attention. Something's going on with my child, and I am the spokesperson. So that's all you're doing is you're not doing anything wrong. You're just calling attention to a certain situation. Again, your doctor or your teacher probably has more experience than you do in their field. However, you possess a knowledge of your child that they will never have. You live with your child. You're the parent. You have expertise in terms of knowing what their typical behaviors and patterns are, and what works and what doesn't work so well for them. Ideally, you'll have a collaborative relationship, and I think most of the time that is how it proceeds, but once in a while there are stumbles, there are disagreements, and what I'm suggesting are just ways to try and work through that so that your child benefits. Along the lines of managing your expectations, if possible, and this is tough, this is very hard to do, to whatever degree you can, try to put yourself in that other person's shoes. consider that the doctor or the teacher probably has a desire to help. They probably do want to do something to help resolve the child's problem. But they're frustrated because they, like I said before, they have another 30 or 40 or 80 patients or students that also need their help. So they're trying to divide their time up as evenly as they can among a lot of people, a lot of students or patients. It can be helpful if you are feeling like you can do this during your face-to-face meeting to acknowledge that it must be frustrating for them, to be prescribing treatment that isn't working for your child, or to be dealing with behavior from your child that doesn't seem to be going away or not responding to various interventions. That can really win you some points in terms of, just saying, hey, I understand that this isn't fun for you either. Having goals is, of course, important, and you probably already have. Even if you just have one goal, that's perfect. One mom who has a very helpful blog, and I'll give you the website for that at the end, advises that you see the big picture for your child and then guard it. Not to get so caught up in details, but to try to remember, what is it that I'm advocating for here? I'm trying to build a life for my child, a future, and a good life for my child. If we have to take this path or that path, maybe it's not so important which path as long as we are going towards that big picture goal. And make your decisions with that big picture goal in mind. Think about what your family values. What is it that's important to you as a family unit? The doctor or the teacher doesn't know that. You may need to communicate to them. Here's what our focus is. Here's what our goal is. Here's the kind of thing that here's how we roll. Think about what your child loves to do. What's most important to him or her? Is this treatment or this educational intervention going to work? Is it just going to frustrate them more? Is it something that they're going to be able to incorporate and the family is going to be able to support? What kind of environment do you want to have at home? These are a little bit vague, but just thinking of these, if you have thought through these things, it'll help you present your goal better when you're actually in the session. So here we are. You've done all your research. You've got your questions prioritized. Now it's time to sit down and meet with whoever it is that you're meeting with. I love this quote by Stephen Covey. Seek first to understand, then to be understood. Meaning, and then he's the author of the 7 Habits of Highly Effective People, and I think this was habit number 5. Rather than coming in with an agenda, and you're here to just put it across. It is give and take. That's the ideal collaborative relationship that we're seeking. So if you can ask questions, and I have some tips a little bit later about what kind of questions to ask, that might be a good place to start. Especially if you anticipate a heated conversation or a really conflictual session, sometimes it helps to just reduce the temperature a little bit if you go in with some questions that you have, so that you can be sure that you and the other person are understanding the same situation and then your goals. Another thing that's a good starter is to acknowledge what good things have happened. The child has done very well in school up to this point, or you've been very happy with the hemophilia center up to this point. If there's been a good relationship, as a foundation, it's fine to just say that out loud. And I have been on the provider side of these conversations quite a few times. And I have to say, most of the patients or parents that I've spoken with have indeed done that. They have acknowledged, and that really helps. At least it lets me know, okay, we're not enemies here. We are on the same page. We both have the same goal, which is to help this child and to, help him get better or help her improve in some way or another. And that really does go a long way. Just get to the point about what your observations are, what you see happening with your child, and say, here's what I think might work. You're not saying this is the only thing I'm going to do or the only thing I'm going to consider, just saying, I've done some research into it, and I think that this might be the answer. What do you think? Say what you want. Be specific. I like to say, nouns and verbs are good. Sometimes that's all you have time for, nouns and verbs. You may have to drop a few adjectives just to get your point across. And ask for help. That sounds very obvious. That's what this whole meeting is about. You need help. But if you just actually verbalize that, sometimes that can be really useful because it makes it clear that this is what I'm here for. I'm not here to teach you a lesson. I'm not here to just vent and get something off my chest. I want help, and I know that you can help on this problem. Another effective thing is to talk about or just acknowledge the areas where you do agree. There may be big areas where you don't agree, but if there are some small areas, it's good to just mention them. You may need to redirect the conversation back to the goal. It's, even teachers, even doctors go off subject and go off on tangents sometimes, so you may need to be the one that brings the conversation back to the main point, why you're there. Again, you have your list of prioritized questions. Just go back to that list. And if you don't understand something, repeat it. It's fine to keep asking. Repetition is good. That's how we learn. One of the questions that you might ask is why this doctor or the teacher has diagnosed a particular condition. What do they see specifically? And what in their experience leads them to think that is what's going on with your child. Ask them why they are recommending the treatment plan or the educational intervention that they are recommending. What other options could there be? Why did they pick this one? It's just clarifying and making sure that everybody understands. Some hard questions that you may need to ask are, not in a negative or threatening way, but what if we choose not to do this treatment? We have had patients choose not to do what we thought was best, what our doctor recommended, and we said, okay, well, thank you for your honesty, and we've proceeded from there. They didn't follow the recommendation, but they kept the communication alive. They were honest. We know what they're doing. They're not doing anything wrong, and we're in touch with them, which is very helpful. So a situation I can think of that may have gone very negatively, in fact, has worked out beautifully because the parent asked that question. It's fine to ask, who else would you recommend that we consult? A doctor should not be insulted by your saying, I'm going to get a second opinion. In fact, most doctors have been the second opinion giver at some point or another, and they understand, particularly if you're talking about your child, that more than one opinion is often a good way to go, just to be sure that there's no rock has been left unturned. It's a good question to ask. If you had to choose one priority, if I had to choose one priority, what would you suggest? So especially in a complex situation, if there are many things going on at once, it's good to get some clarity from the other person on what they think would be the single most important thing to attend to. It's fair to ask, can we accomplish the same goals with a modified approach? Do we have to do prophy 3 times a week? How about twice a week? How about once in the office and once we'll go to our local pediatrician's office, excuse me, if they're willing and able to do an infusion once a week. Being creative and suggesting other ways, often that will work. There can be some middle-of-the-road strategy that can be helpful, or at least be implemented to see if it works. Everyone has probably heard of active listening, which is really simply just repeating and summarizing what you hear, just to make sure that you've got it right. Asking clarifying questions, as I mentioned before. Taking notes sounds like an obvious thing. It is hard to do. If you have brought somebody with you to this meeting, maybe that can be part of their role, is to be the note taker, because it is hard to converse, stay focused on your goals and your list of questions and be writing stuff down at the same time. But if you aren't able to have somebody with you, just do the best that you can with note taking. And if you need to pause, that's fine. You can say, hold on, let me write this down. That's perfectly fine. It's a good idea to ask when you could expect to see some changes or some improvement in your child as a result of trying a new strategy or a new treatment. What side effects should you look out for, and when should you come back for follow-up evaluation? Nonverbal communication. We've all heard a lot about this over the years. Some tips that I encountered in just all the reading that I did. You don't know where you're going to be. Are you going to be in the doctor's office, in an exam room, standing in a hallway? Hopefully not. Hopefully you'd be in a room, or in a classroom, sitting at a tiny desk. Whatever the situation you're in, try and sit across from the person that you're talking with. It puts you on more equal footing if you're sitting directly across the table or facing that person. Of course, make eye contact. And I know it's easy to say these things, hard to do, especially when you're feeling emotional about something that's affecting your child. But it really, what it does is it says that you're serious, you are there because you feel very deeply and very strongly about a particular situation with your child, and you want to contribute to the solution, and you expect that they're going to do the same and that they're going to respect your concern. Lean forward at times if you can, just to emphasize certain points. Don't sit with clenched fists or sit on top of your hands. Just keep them resting on your lap or on the table or desk. Don't cross your arms. Try not to roll your eyes or make dismissive gestures. These things sound so obvious, but if you're really, really angry, think about it. It is difficult to do that in the moment, and particularly if there has already been conflict with this person that you're meeting with, or some kind of difficulties along the way. It requires a lot of self-awareness to be able to get across your points, speak confidently, and avoid doing the things on here. Your goal is to be assertive, not aggressive, not passive, but right in the middle. And I appreciate that is a difficult thing to strive for. One tip was that as the conversation goes on, try and stay focused on the problem, not the person, the other person with whom you're meeting. Like I said, there may be a history of conflict or disagreement or difficulty with that person. And rather than getting wrapped up in, oh, who does he think he is? I can't believe she said that. Try not to let your mind wander to that place. Try to just stay focused on the problem, your child, and, the solution. If you maintain a present or future focus, that is helpful rather than rehashing what has gone over. Sometimes you do need to recap. Here's what we've done in the past. That's fine, but you want to do that briefly and then move on to where do we go from here. Stay on script as much as possible, and I'm not suggesting you actually have a script, but again, that list of questions that you have prepared in advance should be your guide. It's fine to say when you disagree with something, and you don't have to. It doesn't have to be a major ordeal. Just saying, I disagree with that, and here's why. And as much as you can, stay calm and respectful. That will help. Even if the other person doesn't. That is very difficult to do. When the other person loses control or seems like they're going to lose control, it is hard to stay calm in that kind of situation, but do your best. If at all possible, bring humor into the situation. And I know that's asking a lot, but if it's possible at all, that goes a long way in relaxing everybody and kind of bringing everyone back down to earth, and like I said before, just lowering the temperature a little bit. If you did bring somebody with you to your meeting and things are starting to go off on, tangents and unrelated conversations, maybe that person can help bring things around. And I don't mean that they should speak for you, but they may be able to say, hey, remember you wanted to ask about this thing or that, or, remember you told me before. And that's just a good way for them to redirect conversation if needed. These situations are stressful, and we often feel pressured, like we have to figure this all out right now before the end of this meeting. But that isn't the case. You should have time, take your time to make a good decision. If you need to take a break right in the middle of it to cool off, consult with somebody, throw out a lifeline, cry, that's perfectly legitimate. You can just say, hey, look, things are getting too stressful, or I just need a break, That's perfectly fine. Now, the person may or may not have time to give you a break and come back to meet with you. If they do, that's ideal. If not, then make another appointment. Just let things cool down, consult with somebody else if you need to, and come back for another appointment. You don't have to decide everything in one sitting. You may need to collect advice from another expert or a consultant. That's often true in the school setting. There may be a psychologist who needs to evaluate your child and give a report, or some other specialist. So that's fine too. If you don't have all the pieces together when you're meeting with this person, then don't make a decision yet. Wait until you have everything assembled. Sometimes, despite everything, all your preparation, all your insight, your little talk with yourself, and your efforts to stay calm, things just aren't going well. Some of it is in your control, but certainly not all of it. You can't be responsible for what that other person is going to say or do. Like I said before, take a break or reschedule if you need to. Put off the decision till you've had time to think more about it or gather more information. If you had somebody with you in the session, ask them what they think. Or, even if somebody wasn't there with you, you can always ask for their guidance, their opinion. Stay calm. Keep your composure. As we know, angry outbursts can only damage your credibility, and it's not productive. It doesn't help the situation. Even if the other person has an angry outburst, let them go. We can't control what they're doing, but you can control your own behavior. In general, if you only remember one slide from this presentation, I hope this is the one. I thought these tips were great. At the outset of your meeting, acknowledging and sharing what your concerns are about your child is a very useful thing to do. And you may feel like you're making yourself too vulnerable. If I say, hey, look, I'm really worried about my child's future, and is he going to be able to go to school and have a normal life and a career? Or you can hardly imagine going in and saying, hi there, I just wanted to tell you that I disagree with your treatment and I feel very insecure. But if you can acknowledge in some way that part of what's bothering you about the situation is that you just don't know what to do, and you haven't encountered this situation before, or you're just not certain what's best, that's actually a valid place to start. If you're having, you're still struggling with accepting what your child's limitations are, or the diagnosis, or a new diagnosis, sharing that you are still struggling is fine. The reason that these things are recommended is that it builds empathy. If you go in and just say, hey, look, this is what I'm concerned about, my child's future, and what is happening, and I'm not sure what's the best thing, that, again, is one of those defusing situations that just cools things down and lets the provider or the teacher know that you're not there to fight, you're there because you're very concerned, and your child needs attention. Being flexible is always better than having a fixed idea of what is the correct approach. Try yes and statements instead of yes but. Assume that this is a collaboration, even if it hasn't felt like one. If you fake it till you make it, that can work. Strike the balance of trying to speak up. Like I said, assertiveness is what we're aiming for, not passivity. One mom whose website I was looking at said, be respectful but not reverent towards a doctor. I thought of this tip, speak as though you're talking to a new acquaintance. Obviously, this isn't a new acquaintance. This is somebody who you probably know and who knows your child as well. But if you explain things, there are certain things that you understand about your child and your family and your own expectations and values, but your doctor probably doesn't have any idea what your life is like, what your child's life is like outside of the hemophilia center. You can acquaint them with that and just kind of say, here's our typical routine, here's what works for us, and if we try this new treatment, it's going to require some adjustment on our part. That's just valuable information because they don't have any way of knowing the reality of your day-to-day life. More general tips are that, believe it or not, and I know that's hard to believe in some stressful situations that you've probably encountered, doctors and teachers actually do want to engage with parents and families. That's why they got into this line of work. They like people, they like problem solving, and they like direct contact with patients and families. We all know that when parents take an interest and get involved, the child is much more likely to succeed, whether it's in school or medically. We like it. I'll speak for myself and the folks that I work with at our hemophilia center. When the parents are involved, it gives us a sense of hope that things can really turn around and get better because we know that parents are staying on top of it, and we appreciate that. Eventually, you'll get to a point where you just have to make a decision. Are we going to do this treatment or not? Are we going to try this new educational plan or not? You'll have to make the decision, and then one mom advises, move on. You can't help second-guess your decisions. That's just human nature. But try not to get caught up in that too much. Try whatever the new strategy is, or if you've decided not to pursue the strategy, then keep going on with what you're doing, and don't get too bogged down in it. Everything is reversible. If you decide, that the treatment plan that was recommended or your own plan that you're following, if it's not working, you can try again. Try something different. Importantly, don't give up. this is your child. You're not likely to give up because we all want what is best for our kids. But keep trying, until you see something changing. Whether it's, a medical health situation or a school situation, when kids are involved, things can change quickly. A fever comes out of nowhere. And don't be afraid to go back. Maybe yesterday your child was doing this thing, but now today they're doing something completely new. If things change, you need to let them know that. And, if you've tried a new treatment regimen and it's just not working, or an educational intervention isn't working, let them know that. There's got to be something else you can try. These two resources I thought were really, really valuable. They're both websites. The Matrix Parent Network and Resource Center is an educational advocacy website, but they have a lot of good tips on there that I think could be generalized to other settings outside of school. And I know it seems unusual. The National Coalition for Cancer Survivorship had a fabulous resource section on communicating with your doctor, 10 things that doctors would like to know about their patients, 10 things that patients wish their doctors knew about them. It was really very valuable. So even though it's looking at advocacy through the lens of cancer, their tips and everything were very generalizable to other medical situations. So check that one out if you get the time. These are the other websites and references that I used for this presentation. A couple more. And we are now at the point where I would like to open up our panel discussion with Cassandra and Amanda. Are you on the line?
Hello? I'm here.
Okay. Both Amanda and Cassandra, are you on the line?
Yes.
Terrific. All right, we have a few questions that we want to go through with you all, and then hopefully some of the people participating in the webinar will have some questions for our panelists as well. The first, I'll just ask Cassandra if you wouldn't mind starting. And tell us who's in your family and give us the story of a situation where you've had to advocate for one of your children.
Okay, great. Thank you. Thank you so much for having me. I have two sons with severe hemophilia, and both have had inhibitors. And also my husband is my partner in crime, who is the one who balances out the craziness that the crazy parts of advocacy that I can get to, because I can tend to get very upset and vocal. And then when he gets that way, I balance him out. So I'm very fortunate to have him as a partner in this journey. My oldest son, Julian, is 18 years old. He had an inhibitor when he was 1, and for 2.5 years underwent immune tolerance. Did very well with it. Had one port, no infection. It was pretty good until he went from port to peripheral. So that's where his journey took him in a lot of difficulty. But he's doing very well. And my little boy, my Caleb, my little warrior Caleb is what we call him. He is now 9, and he has just reached his 3rd month in a row of having a 0 Bethesda unit. And so it's been a long journey. He developed his inhibitor, a very high titer inhibitor, when he was 11 months old. And so you can see that 8 years of that is a long time, and I know a lot of people, it's a lot longer, and it's different for everybody. But one of the situations I was trying to narrow down, what is one of the times where we have really advocated for our children, and most recently I think it has to do with our little guy Caleb. He missed quite a bit of school in his 2nd grade year. He's in 3rd grade right now. And from October 2014 to February, October 2013 to February 14, he was in the hospital constantly. I mean, it was hardly any days we were home from a bleed that just would not stop. And it was during this time that I was in constant contact with his elementary school. And we would pick up homework every week or every couple of weeks and make that a pretty regular thing. Unfortunately, he was not able to get a lot of his work done in the hospital because of the amount of pain medication he was on. That's the last thing in the world you want to worry about. But, as parents, we want to keep as much normalcy going for our children as we can. So, even though it was hit and miss, it was there. It sat there as a reminder, and I think it was also a little hopeful for him because he would see his books and his crayons and pencils knowing that, his friends are waiting on him, and he's going to get back. And sometimes that's all he had to hold on to. One of the things that I did, in addition to keeping in touch with the school, every couple of days we would call and let them know, where we were at in hoping to return. But I worked with the Child Life program at the hospital, at UNM Hospital. And what they did for us, and I told them the need that we had, it's like, working on homework, as many of you who are parents know, working on homework, we would rather just pull, our hair out or teeth from our own mouth than have to do second grade or third grade homework any night of the week. But when you're in the hospital, surrounded by all the craziness that's going on in there, it's kind of, it's really hard to do and to focus. And so what Child Life did with us when we told them of our need, they worked it out, especially for Caleb, to get volunteers in at certain times of the day to come and do, 15 or 20 minutes of homework. And so we had a new kind of routine in the hospital. And boy, I tell you what, it sure helped quite a bit. Sometimes a parent is not the best person to help in some situations, but what we can do as parents is advocate to make other things happen for the betterment of our children and for our own emotional well-being. Thankfully, we had a 504 in place for Caleb, and it helped with giving him additional time to get his work in. It helped to protect his absences. 504s are a wonderful thing to have if your child misses quite a bit of school or has some extra needs that can be met through having those meetings once a year with that committee at your school. It wasn't a concern about his absences and all, but I was very worried that he would fall behind so much that he would need to repeat second grade. Now, there's worse things than that, but I just wanted to keep moving forward for him because his spirit during this long hospitalization were really starting to drop. And if anybody knows my Caleb, I tell you what, he is one spunky kid, full of life. And then for this to finally take away some of that spirit was very scary for my husband and myself. The next part of working with school came when it was great because finally we were sprung from the hospital and he was doing better. But the issue is that he was in a wheelchair with a leg rester, so his leg had to be elevated. So, getting around was pretty difficult in a small classroom. But his dad and I felt that it was definitely in his best interest to get to school as much as possible rather than homeschool him or have homebound services. We just wanted to do everything we could to try to get him back where we thought he belonged and where he wanted to be. We went in to talk to the teachers and the clinic staff about Caleb's situation before we were ready to bring him back so that we could work out a plan that everyone was comfortable with. I think one of the most important things that we did as advocates for our son is that we told the teachers and staff involved with his care that if this is too difficult, okay, you need to let us know so that we can figure something else out so that he can continue with his education and his schooling. But I'm going to tell you what, these people were just amazing. They did and continue to do everything possible to keep that boy in class. And I would find out later about things they would do that I never asked. If Caleb's knee was hurting a little bit and he would go to the clinic, you know, the nurse made it a schedule where she would bring him in every 20 minutes, or not every 20 minutes, but like every couple of hours for 20 minutes to ice his knee. And you know, these school nurses, if you've ever been in a school clinic, they're a zoo. They're crazy. And so the fact that she took the time to do that, to keep him in school, she could have easily called me and said, Sandra, you know, Caleb, he really should probably go home. I would have been there in a second to take him up. But that's the kind of a relationship that we had with these wonderful people at his school. And eventually, Caleb started to get out of his wheelchair, but just in the classroom, and he would kind of hop around. He has a funny little hop that he would get where he wanted to be. And so now we started a new thing where every morning, either my husband or myself would send an email and say, okay, today's a hopping around day. It's okay. And then it was, okay, today he can walk to the restroom in the cafeteria, but he's got to be in the wheelchair the rest of the time. And then finally, no wheelchair. In this past November, he spent over a year in that chair, and he worked like I've never seen a little kid work to get out of that chair and not be dependent on it. And he even said, Mom, can we sell it now? And I said, no, honey, not that custom wheelchair. We cannot sell that. But he wanted to get rid of it. And as we continued to progress, we kept in constant touch with his teachers to let them know what they could expect. And there was one day, I have to share this funny part of the story, is that one day I walked in to go pick him up, and the PE teacher saw me. And she zipped out of the auditorium or the gym, and she had this wild look in her eye. I mean, like she had seen a ghost. And I'm like, what is wrong? And she said, Ms. McDonald, all the kids were running laps. And before I knew it, I saw Caleb with them. And I said, okay, that's all right. She was just panicked because she hadn't seen him do that all year long. And I had to, you know, make sure I wasn't laughing because it was kind of funny. Because, you know, all of us hemophilia folks, we have a funny, a twisted sense of humor sometimes, but that others don't understand. But I told her, I said, it's okay. And I said, you know what? He wants to be a boy. He has some catching up to do, and that's all right. And I went in, I reassured them. I said, you know what? He's going to fall sometime. He's going to have another bleed, but I just don't want you to treat him like a China doll. And I think
that's, Sandra, that's a great story of, you know, persevering, both on you and your husband and, of course, Caleb, more than anybody. It sounds like you really did the groundwork to build a good relationship before he ran into medical problems.
Right.
And you communicated with the school, you know, what your goals were, to keep him, you know, as much as he could on target with his homework and progressing through second grade despite a lengthy hospitalization. And then eventually to, you know, you wanted him to be in school where he should be. I think it's great that they respected that, and you know. But I just have a feeling that you didn't start building that relationship when problems hit. It sounds like you already had the groundwork in place, which is fabulous. That's wonderful. If I can ask you, Amanda, to tell us, you know, who's in your family, and give us the. I know you have a very different example of advocating, and let us hear your story, please.
Sure. So it's here in our household is me, my husband, and we have two sons, Alex and Peyton. Alex is our older boy. He does not have hemophilia, and Peyton is our 5-year-old who has hemophilia, severe hemophilia A with an inhibitor. And just give you a little bit of background, so you kind of need the background to understand the whole story. Peyton developed his inhibitor at 10 months old, and then when he was 18 months old, he was started on ITT. It was actually started after we went to our first inhibitor summit, because we learned all about it then, and then we went to the doctors and told us that's what we wanted to do. But that's another story. So he was on the ITT for about 4 months, and he was being treated at our HTC. So we had a physician there, and we loved him. And after about 4 months, he told us that he was leaving. He was going to accept another position. So, of course, we were devastated at that time. Of course, the HTC had lined up another physician, and we started seeing that physician then. And when we first met her, we had talked to her about Peyton and hemophilia. She, at the time, had no experience with hemophilia. This was her first round with hemophilia. She was coming from another background in the hospital, and she was taking on the hemophilia treatment center. So we said to her, that he has an inhibitor, that he has severe hemophilia A. We said, do you feel comfortable treating him? Is this something you feel comfortable with? And she had told us, yes, that she was comfortable with it, that at the time that she would go ahead and seek any kind of expert opinion from other physicians in the area at other HTCs if there was something she was uncomfortable with. So at the time, we felt very comfortable with that. We didn't want to switch HTCs just because of the new physician, because we live very close. And she made us feel comfortable that she would find an answer if she didn't have an answer. So at the time, we decided we were going to stay there with her. And one of the reasons we wanted to stay there was because there were so few patients at the center that have inhibitors that we were hoping that something could be learned from Peyton for the future kids. So we stayed there, and probably 6 months went by. We didn't really have any issues. And after that time, basically last December, we started to have some issues. Peyton started having joint bleeds that he hadn't had before, and he also at the same time developed iron deficiency anemia. We went to the physician and said, actually, no, we didn't go there. We called her. We called and spoke with the nurse and said, should we treat this iron deficiency anemia at your center, or should we go to his family doctor? And they said, oh, no. She said, come here. You'll get treated here. We said, okay. So we went, got lab work done. They gave us results. We still, at that time, were still trying to contact the physician, who we still have not met with. So we now have Peyton, who's having joint bleeds and now has iron deficiency anemia, and we still are not meeting with the physician. I kept calling. I kept asking to speak with her at least, or get an appointment, and they kept telling me, she was out of town, she was this, she was that. There was all these excuses. So everything kept going through the nurse at the time. So then finally, we were still dealing with this anemia, still dealing with the bleeds, wondering if we should increase his dose, if we should switch factor, if his inhibitor had gone back up, and still not getting any direct communication from the physician. So then at that time, the physician decided that she wasn't going to treat his anemia, that we had to go to the family doctor. So then we had to start that whole process all over again and go to the family doctor and have blood work done again. So now his treatment has been delayed from receiving treatment for the anemia, plus he's getting joint bleeds. So needless to say, I was pretty upset at this time, and I continued to try to call to actually speak with the physician, and still had no contact with her. So he had a clinic appointment coming up. Within this time period, there was a clinic appointment. So we decided that we were going to discuss this then. We also decided prior to the appointment that we were going to consider switching HTCs, basically dependent on what happened at that appointment. So we went to the appointment. We decided we were going to confront her, ask her, why we couldn't get a hold of her, why these needs that he has were not being met. And it was quite apparent to us that she just really, I have no other way to say it, but she really just didn't seem like she cared. And it was pretty upsetting to us at the time, because it was obvious at the appointment that she just really did not care what we thought. She wasn't really willing to change his factor. I think she wanted to increase his dose a little bit, but she wasn't willing to try any other option like switching. We were considering switching to a different factor brand to try something new because he had been doing ITT for over 2 years at that time and had little change. So at the appointment, it was pretty, I have to say, it did get a little heated at that appointment. So at that time, we had some goals, and we were interested in basically treating his bleeds that he was having a plan for his anemia, and deciding whether or not we were switching HTCs. And basically, after that meeting, we had come out and decided that we were switching HTCs because we had clearly had the trust broken with that physician. And at that point, there was it was kind of at the point where there was no turning back. We were not going to rebuild a relationship with a physician that we could not contact. So we, at that point, decided to switch HTCs, which is what we did. And then later, we actually found out at that appointment later, during the appointment, she had given us lab results of his that were incorrect. So we were able to, there's this handy thing on the computer that you can log on and look at your own results. And so we did that the next day and found out that his inhibitor had gone back up, and she told us it was 0. And we had labs that were not right.
Wow, that's a very challenging situation. And, it sounds like you gave it your best shot, but sometimes that is the answer, is look elsewhere. You have to do what's best for your child. So you've made the switch now?
We did switch.
Yeah.
And it's going very well now. We actually are at the point now where we're kind of rebuilding our relationship with that HTC because that physician is no longer there, and they do have a new physician, and we like him very much. So now we're kind of at a point where we live 15 minutes away, but we like the new. So we're kind of at a crossroads right now where we're not sure what we're doing at this point.
Well, you're proving the point that I made earlier, that things are reversible.
Right.
You can change your mind as you go. People do all the time, and I'm glad that it's your choice rather than in so many situations insurance dictates. You're not going to go to that treatment center or that doctor. You're going to go here now, or you're going to use this factor, not that kind. So I'm glad that you are still in control of making the decisions, for your child's health. Both Cassandra and Amanda, looking back on your situations, is there anything that you would do differently?
As for my, relationship with school, I don't know that I would do anything differently in this situation because where we're currently at is just ideal. And I know I have friends across the country who have nightmare stories of their schools. And I'm like, are you kidding? They won't let you do what? and I'm very fortunate. But we did have a bad situation when we lived in a smaller town with limited resources. And that's when you have to really get those advocacy guns out and really just, educate and bring people in if you can and do everything above and beyond. And that's when it's really hard, when there's just limited resources. But my whole thing is, you don't give up. And you find the stuff that you need to pass along, and you're there every day if you have to be until they get it.
Were you in a situation, Cassandra, where you either organized or were part of a group that, in the community that organized about a school issue?
Yes.
Oh, okay.
We had and so we had a nurse that was pretty much could put Band-Aids on kids, and that was about it. And so it was quite a struggle. When Caleb was in pre-K, when he started having all his issues with his allergy to factor VIII and all of this, and we were just trying to keep him in school, and it was a challenge.
Amanda, is there anything you wish you had done differently?
I'm not exactly sure what I could have done differently. I think we tried everything we could. I think there were things out of our control in that particular situation, because we tried pretty hard to get a hold of the physician, and like I said, we ended up switching HTCs and ended up having some changes done that way. We were very lucky at the time that, still, our family physician, I love our family physician, so he's really good, and he pretty much, when we went to him with the situation, he said, I'll do whatever you want me to do. Whatever you need me to do, I'll do it.
That is very helpful. You had an ally in your corner.
Whatever you want.
Good. What was the most difficult thing about speaking up for your sons?
I think for me, it was just making sure I had my homework done, and that I had an opportunity to think about, okay, this is what I'm looking for. Is there a reason they can't do this? And having my notebook, that's one of the things I always tell patients I work with is always have a notebook with you, because you never know when you think of a question or you make your list, because you're going to forget when you get in there and your heart's racing and the adrenaline's pumping and you're ready for a fight because we all do that. We're ready for a fight. We don't want to have one, but you want to have all of that information there. And I think preparing as much as you can. Sometimes it's not possible, because you might be bombarded with something completely out of the blue when you're sitting in clinic or something. But I think that is something that I try to pass on and I try to practice myself.
That's great advice. Yeah, just doing the homework. And like you said, you don't always get that chance, but, to the extent that you do, gathering facts and other people's perspectives is all really valuable, and, it'll steer you in the right direction when you're sitting face-to-face with somebody.
And when you don't know, when the doctor's there telling you, this, that, and the other, and you're like, what in the world is he talking about? You say, okay, wait, can you explain that again and let me write it down? because sometimes it won't sink in until a lot later, or you need to go talk to your friend whose kid has been through this, or go look things up or talk to your nurse or whatever. So,
very good advice. Amanda, what was the most difficult thing in your situation about speaking up?
I would have to say I can't really think of anything that was too difficult. For most people who know me, I don't really have that much of a problem speaking up. Especially in the clinical setting, I think it might be a little easier for me since I do have a nursing background. I'm not intimidated by the physicians or the staff at all, and I don't really have a problem speaking up to them. I do have to say that the place that has gotten me tripped up before is whenever we go to Washington, D.C. Or Harrisburg. In that arena, I get a little bit more intimidated and a little bit more, I think it's a little bit more difficult for me in that situation when you have to speak with the senators and the congressmen. We've done it a few years, so it's not as bad now, but the first couple of years was a little intimidating.
Oh, sure. You're out of your element. It's not your normal routine. Tell us about your advocacy efforts on behalf of the greater community, including your son.
In D.C. in that, or?
Sure. Yeah. D.C., Harrisburg. Yeah.
Yeah. We've been doing Harrisburg for. I've been doing Harrisburg for quite a while because I didn't add that I also my brother had hemophilia, severe hemophilia A with an inhibitor also, so I've gone to Harrisburg several times with him. On the Harrisburg level, our state level, we have very, very good relationships with the representatives and even our local senator now, who was just newly elected. We have formed some great relationships with them. Many of them had no idea what hemophilia was before we started doing this. One thing that we always have to do is make sure that for us here in Pennsylvania, I'm sure it's the similar to in other states, we have to always make sure that our funding gets put on the budget every year. So that's one of the biggest challenging things. But since we go back year after year, the representatives who, obviously not the newly ones, but the ones who have been there for years, they know us now. We go in and they now know Peyton. They know us. They know us by first name usually, and they recognize us. They know what hemophilia is, and we know that we're going to get their support. So we've formed good relationships with them, and every year we continue to go back. And I think anybody who has a chronic illness, that is very important to form those relationships, because you might not think that they're not doing what you want them to do, but they might have no idea what you are about, because many of them had no idea what hemophilia was about until we told them. And now we usually always get their support on the local level. Now, the federal is a little different. They're a little harder. They're starting to know us.
Yeah.
They're just, I don't know, there's something different about them. It's a little bit harder to convince them to do what you would want them to do. Whatever the hot topic is that year, whether it's a bill that you want them to support, it always seems like it's a little bit more difficult to get their support.
I think everything's it's just on a grander stage. It's everything is bigger than going to your local state rep.
It depends what's happening at that time of year also.
Right.
Like in the budget with the, I don't know.
As an HTC employee who benefits from your advocacy efforts, because our center is federally and state funded, and I happen to be in the same state as you, I have to say thank you for your efforts. That's what keeps us up and running, and of course the goal is better treatment and better outcomes for all of our patients. So for the folks who are listening to the webinar, if you check out NHF's website, just about every page has something on advocacy. That's definitely a growing topic, and I know our chapter here in Western Pennsylvania has an intern, and that is her passion. And she's young, so she's really reaching out to the young adults in our area and trying to stir them, to get as passionate as she is about advocacy. So that is definitely a hot topic, and I'm really grateful for the efforts of anybody who goes to Harrisburg or the state capitol or our national capital to just tell them the story. That's really all that that matters, is introducing them to the idea that there are people with bleeding disorders, and we depend on the grants that are made from federal and state governments to keep their care going. And, of course, access to factors. There's a whole lot of things. We could go on and on. There's so much that our effective advocates do on behalf of all of us. Before we open up for questions from the participants, I just want to ask for a closing statement from each of you, Amanda and Cassandra. What one thing would you stress to the parents who are listening? What's one best thing they can do when they're advocating for their child?
I think the one thing, I know that we realized it right within the first day that Peyton was born, that there is no one that will advocate for your child the way you will. There are nurses and doctors and social workers who care and will help you, but at the end of the day, it's your child and you're their number one advocate.
Words of wisdom. Cassandra? Cassandra?
I'm sorry, I was talking to myself because I was muted. I do that all the time.
Oh. Let us all in on it.
Well, let me tell you again. Just a couple of quick little things is that I say this for myself more than anybody, and I'm sure you all can relate, is, try not to fly off the handle. When you want to just grab them by the throat and choke them, you know what I'm saying? You just get so angry sometimes. and you want someone to listen, the hardest thing to do is to try and be composed and professional and breathe a lot. You know, when you're trying, because you're so passionate about your children, and you want people to understand. You want this doctor to understand that this treatment's not working, and we need to go back to this, that, or the other. You know, trying to breathe and trying to be as composed as you can, I think says a lot, because that gains a lot of respect when you're in those situations. But it's not always possible. It's just not, because sometimes a clinician needs to hear a mama bear roar once in a while. So just, you know, remember that, and I think, you know, try to keep those emotions in check when you can, but know that everything we do when we advocate for our children is fueled by that passion that we have, that love that no one can understand unless they've had a child. And it's more about, it's not even just about hemophilia. It's about, this is a rare disease. You know, it's a chronic condition, and a lot of people can relate to that. And sometimes when you're talking to them and you put those words in there, it helps to make a little more sense to them.
Thank you both. Such words of wisdom. I really appreciate both of you sharing so many stories. And, you know, you both walk the walk. You will be walking the walk for some time to come. And I hope that the folks that are listening tonight or this afternoon have really taken in the wisdom of, you know, your own experiences, and I really appreciate your allowing us a peek into your family's situations so that we can all benefit from that. Annette, I want to ask you if you want to moderate question and answer time.
Thank you, Diane. Ladies and gentlemen, to ask a question via the web presentation, please select the chat pod located in the lower left corner of your screen. Type your question into the text box and click the Send button. If you would like to ask a question live via your phone, please press *1 on your telephone keypad. I will announce each caller prior to bringing you into the conference. Please remember, if you have your phone on mute, take it off mute when you are selected to ask your question. Once again, to ask a question via the web presentation, select the chat pod in the lower left corner of your screen, type your question, and press the Send button. To ask a live question, please press *1 on your telephone keypad. Thank you. And Diane will take our first question. In what other areas have you used advocacy skills? Work, school, family, other relationships?
I have a great example of something that just happened a couple of days ago. My oldest son, Julian, has a part-time job at the local ice rink. And he's been taking on more responsibility. And he came to me and he said, you know, Mom, I really feel like I deserve a raise because of the things that I'm doing. And so, you know, I put on my advocacy hat there, and we talked through about how you approach it and how you talk to somebody about, you know, all of this. And he was like, oh, okay, that's great advice. And anytime your 18-year-old tells you that, it makes you feel good because you don't feel so stupid, right? Because we all are when they're 18. But he took the advice, he went in, and he got the raise on the spot. And so I was just tickled to death because, you know, all of those ways that you approach people and have that calm demeanor and just, you know, help them understand where you're coming from, you know, it paid off for him. I know it's a completely different example, but it worked.
That's a great example. What a victory for him and for you to get that kind of vote of confidence from your son. It's just wonderful. And I'm glad he got a raise.
Excellent. Thank you for sharing. We have no further questions at this time. Well, thank you to our speakers and Cassandra and Amanda for joining us.
Thank
Your
you.
feedback is, thank you so much. Your feedback is critical to us, not only in measuring the efficiency of this webinar, but also in planning of future inhibitor-related activities. Please complete the 5-minute survey. The link is appearing on your screen now. And lastly, a quick reminder to join us on Wednesday, March 25th at 7 p.m. Eastern for our next webinar, Learning to Let Go, Fostering Independence. Thank you for attending. This concludes our program.